Okay.
So I'm going to start with a little presentation and just welcoming people. So I want to welcome people to the European Forum for Primary Care webinar series. And today we have the Paradiso project with us, and we have George and Michalis, who will be presenting themselves soon. And we're talking about raising awareness and fighting discrimination against sexual and gender orientation in healthcare sector. Just remind you that you can actually ask them questions either along the presentation via the chat box that you have there. You can write question, I'm going to type. And there you can make your question, but please try to do it along the presentation and not just at the end. So in the moment that you have a question, just type it there, and we will be collecting them and posting to everybody at the end in the screen. Just remind you that this is a webinar series, so each month we try to have a different webinar. And next one will be in May, probably on mental health, and in June probably we will have one on primary care and leadership. So please be aware of that. And I just don't want to take more, and I give the floor to George and Michalis. And please, if you can actually open your camera so people can see you and while you present yourselves, and once you present, just close it, please.
Okay, am I talking?
Yes.
Yes. Good morning, everyone. Good morning, dear colleagues from EFTC, dear colleagues who attended this webinar. Thank you very much for giving the opportunity to present the Paradiso project. My name is George Koulierakis. I'm Associate Professor of Health Psychology at the National School of Public Health, Athens, Greece. And I have been honored to be the coordinator of this project for the last 16 months. It's a pleasure to be here with you, and I'll be glad to participate and listen to my colleague Michalis and answer your questions. Thank you very much.
Mm-hmm. Hello from my part. Let me just share the screen. Yes, it's Michalis Lavdas. I've had the pleasure of working with George, who spoke before, Professor Koulierakis, along with colleagues from the EFTC and other organizations who are involved in LGBTI issues, as well as public healthcare, public mental health care, and other relevant sectors. So it's going to be a pleasure for me to talk to you a bit about the project, about relating specifically with the Greek experience, and we will be happy with George to answer to any of your questions, either during this webinar or through email or other way that you might find more accessible to you. Diana, Diedrich, do you want us to start directly?
Yes, please go ahead. So if you share your presentation and close your camera, that will be great.
Good. So you let me know if there is any technical issue. I will close the camera now, and I will. Yeah. So now you must be seeing my desktop. Okay. So we start with this webinar and with the title of the project. Why is it called the Paradiso project? It's the initials for Participatory Approach for Raising Awareness and Fighting Discrimination against Sexual and Gender Orientation in Healthcare Sector. One of our main ideas was when we started discussing how to, what is the need and what we can do, it was the idea that in Greece, recently, many laws regarding LGBTI human rights have been passed, but still, we saw that there is a gap between theory and practice. So what do we do to address this gap? Bringing together LGBTI organizations in Greece, as well as major academic and clinical stakeholders, was the idea of creating a common language and addressing the barriers that LGBTI people face in the healthcare sector. In this sense, the context of our work is that which WHO states as well, that LGBTQI plus people face major barriers accessing appropriate patient-centered healthcare. Many times we see that LGBTQI plus people avoid using health services, they fail early interventions and systematic follow-up, they do not complete the necessary treatment for their health, and there are cases where professionals have even denied health services to LGBTQI plus people. This was something that we actually saw when we first did the needs assessment phase, when we held focus groups with both professionals and people from the LGBTI community, where many cases of people being stigmatized or people being afraid to talk openly and trust their healthcare provider were noted. What did we discuss on this? We discussed that this extended stigmatizations and ignorance regarding issues on sexual orientation and gender identity, both within society in general and within the healthcare system in particular, are really existing in a way. Many times, the first response from professionals was, we're here to treat everybody. But this is very distant from the actual, let's say, reality in the healthcare system, when many times professionals do not know even how to address properly LGBTQI plus people, and especially for transgender individuals, this was many times the case. Discriminatory attitudes and lack of specific knowledge among health professionals was also a case. Many times professionals had stereotypes and constructs made up about how an LGBTI person is looking like. So in a way, as our esteemed colleague Panagiotis, who was in part of the public health school, he was saying that the first goal of our trainings was to show people that an LGBTI person is not a person that is different than any of us. We should not be looking for special characteristics in a way that someone has, like he's from outer space, as he specifically mentions. In a way, what we want to say is that we have to build inclusive care, we have to address all different needs, and we have to be there to see the need. Many times, we do not see what we do not know. When we were discussing with people from social work who said that we're really open and friendly, when we took a look around, there was nothing that would say that this service is LGBTI friendly. There were maybe pictures of families, traditional families as we've seen them, and there were no pictures of LGBTI families, for example. We can do small things which can create a trust between the people who are receiving services and the people providing them. Also, another level that we also tried to focus was healthcare sector and LGBTI professionals within this sector. We realized that there were even cases of a person who, when he was outed in his healthcare work, he had to change hospital because there were many stigmatizing attitudes against this person. So we're really late in introducing inclusive policies and in bringing together these major academic clinical organizations that they have to work because it's part of their human rights agenda. LGBTI rights is human rights, and this is what we are really supporting in this project as well. So the general objective, I've already talked about it, is to create an inclusive and safe environment for LGBTQI plus people and fight discriminations in the healthcare sector due to sexual orientation and gender identity through participatory activities with health professionals. It's very important for us to be able to work together in Greece, in Paris, in EFPC, in different places, and to be able to build alliances. The duration of this project was from the beginning of 2018, and it is going to end in the next few days. And we're really hoping that this is a start for the Greek healthcare community and also for communities in Europe and in the rest of the world, hopefully, so that we have built a material, training material, and booklets with guidelines that can be useful for healthcare professionals. You can see here that we had the partners from 3 different countries, And it was very important for us to work with all these different organizations and specifically mentioning how the lesbian and gay community in Greece participated as a major partner in this project. We had five different work packages. The first one was about management and coordination of the project. The second was to develop targeted LGBTI principles and guidelines for the health professionals. The third, preparing LGBTI plus medically and culturally competent healthcare professionals. The fourth, piloting an LGBTI culturally competent structure and assessment of the main project outcomes. And in the last work package, it means about the dissemination of the project. I just want to pay attention a bit and say a few more words about the piloting of the intervention, where the organization I'm working for, EPAPC NGO, which employs about 250 employees all around Greece, was part of this piloting project. And what we realized was that we really need to start in systematic and systemic changes. This means that we have to bring to the surface cases where a person has felt that he's not feeling safe. We have to bring light and shed light to how we are providing care and how we are treating cases of people who say that they don't feel safe. It's very important for us to create an environment for both professionals as well as users of the service to feel safe to express themselves. What is Greece then? I just start with this, that it was, I did it yesterday. It's just a Google search. You can do it if you like. Greece is Greek islands. Greece is for lovers. Greece is mine, okay. Greek island, Greek Athens, Thessaloniki, and maybe you've already visited places in Greece. But I just want to say this. Is really Greece for lovers or for a separate kind of lovers? We don't accept all kinds of love. We just discriminate against different kinds of love. And this is what we want to say, and what was part of the culture and the let's say of the ideas that we also try to express during our trainings. Because if you don't let a person feel loved, if you don't let a person express this love, if you don't let a person openly join in activities of different sorts, then you're creating social determinants that are actually burdening the health and mental health of the person. So our stance and attitude is strictly not to pathologize. This is also a Greek word from the word pathos, not to pathologize LGBTQI plus issues, but to pay specific attentions to all these determinants that are burdening health, are burdening mental health, and are excluding people from receiving the care they have a right to. I think there was this notification for a question, so let me go. Was it? No, there wasn't. I'm sorry. False alarm. I'll just go on to show you the map that ILGA has created. It's very interesting. I also saw that we have participants from ILGA, and it's very important for us to be able to reach out in this European level. We can see here what is the condition about the laws, about the legal state in the world. We can see how much progress needs to be made. And this is only for the legal issues. We see about criminalization of LGBTI behavior, protection, and recognition. We just see that a small number of states provide for marriage and partnership concurrently. What we've seen, for example, in Greece now, is that there is a recent law that can allow LGBTI people to become foster parents, but still they cannot proceed to adoption. So it's like giving them something, but still there are much more to be done so that we can have actual equality in terms of human rights. And I believe that we have to move towards this direction. There are many different examples, and we have to work in different areas, let's say. And for example, there is another area of working with LGBTI migrants and refugees from countries where it might be a criminal case to be an LGBTI person. So it's very important for us to create links with different good practices. It was very important for me personally. I was last month in Norway, and I happened to visit Queer World. Queer World is an organization which consists of LGBTI people, and I specifically met with the organization in Bergen, which was run by LGBTI refugees. That was really important to understand and listen to LGBTI human rights from different perspectives. It's very important to be able to reach out to different populations in Greece, to educate local people, to educate migrant and refugee population, and to actually work with what we call close communities. A close community is not only a community that is in a way isolated through geographical reasons, but it's also a community that is isolated for cultural reasons or for reasons of sexual orientation or gender identity. Here you can see the Rainbow Europe map, where you can see what's the progress in different European countries. And you can see that Greece has achieved 52%. But if you actually ask around, there are still many cases that are reported about hate crimes, hate speech, and even made by public figures in religion, public figures in politics, and we're really fighting towards this, and we still have a lot to do so that things in reality are matching what the law says. So what's behind the rock? This is a picture I took when I was working for the mobile units in Greece, in Cyclades, where you can see a very beautiful sunset, but you can see that sometimes mental health issues are thrown under the rock, are hidden many times. We've explained before how it's important to address mental health issues, not in a pathologizing way, but in a way of understanding the barriers and the discrimination that LGBTI people face, so that their mental health is then burdened. We can see here, as I was working in these islands, which are very beautiful for tourism, but you can see that there are many hidden places and hidden crypts in these places. I was working with an LGBTI person who was telling me that I have to move out of this place if I really want to have a life of my own, if I really want to find a partner and to be able to actually enjoy some things in my life. So this person did not come to me as a psychologist because there was a clinical depression or something else, but because the society, in the way that it was built, did not let the person be the way the person needs and wants to be. So it's very important for us to be able to reach out not only to the big urban centers where someone can hide perhaps more easily, but to be able to shed light in different places, understand racism, understand discrimination in different places, in different areas, and especially to places where there are very few services there. So if we want to understand mental health, as WHO states it, is not a case of symptoms, but it's a case of well-being. I'm sure you're well aware of this, in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. There was this person that approached me in one training in northern Greece that told me that, well, I was working in a bar, and when people learned about my sexual orientation, they started being discriminating against me. I had to quit my job so that I could have peace of mind. And we can understand how discrimination can exclude people from work, can exclude people from what makes you mentally healthy. So what does WHO says? They say about the social determinants of health, which are the conditions in which people are born. Where are you born? It's different if you're born in Athens, it's different if you're born in Paris, and it's different if you're born in a small island, for example, Paros or Mykonos, where there are some cases of some seasons which many tourists come, and then there are many seasons when these people are locked behind the doors. So where are we born? How do we grow up? Where do we work? How do we live and age? And what are the wider set of forces and systems shaping the conditions of our daily life? These forces and systems include economic policies and systems, development agendas, social norms, social policies, and political systems. So if we approach mental health in a different perspective, let's say we approach it from a recovery-oriented perspective. What is recovery? Recovery is a lot of things. But what our friends and colleagues, Larry Davidson, Bengt Carlson, and Marit Borg are saying, that recovery is a person's effort in getting on with life, with and without help from professionals. Professionals are not always necessary. It's very important to be able to empower, to facilitate empowerment in people. And as Ron Coleman was saying, this great activist for mental health, he was saying that power is something that is taken, is not something that is given. But what we can do as professionals is to be able to facilitate empowerment, because there is no mental health in an isolated area, let's say. You cannot be alone and well, but you have to have a life in community. You have to have human rights, proper living conditions, citizenship, opportunities. And as they say, it's very important to be loved and to love someone, to be needed and to need someone, and to be able to have pleasure and have fun. There was another case of a person who was thrown into the sea because he was walking hand in hand with his lover, with his friend, because it was assumed that he was a gay person, and the discriminating behavior was that we cannot let you be openly gay, for example. We cannot let you in our community. And this kind of exclusion is burdening mental health, is actually putting a barrier to recovery. It's also very interesting to understand recovery as recovery in the bin, as are saying. It's a very interesting blog that you have to look for it. And it's users, mental health users, who have actually founded this blog. And what they're saying is, okay, you're talking about recovery, but recovery is not only for professionals. It's not the professionals that need to tell people what to do and what not to do. We cannot recover if you say that you have a good example, you have a good psychologist, for example, in your NGO or in your hospital who is LGBT friendly, but all the rest of the people are actually not that friendly, are actually discriminating the person. Or it is not, let's say, effective if you're doing a good practice in a small place, but still you have people excluded from work. You have people viewing LGBTI people as traumatized because of their identity. It's not recovery when you don't have stable housing, when you don't have rights, when there is sexism all over the place, when there is economic inequality. And we can understand how all these places, all relating to transphobia and homophobia, all these barriers are actually preventing a recovery, are preventing someone from being mentally healthy. And we can understand that LGBTI is actually a cause for many people to show discrimination. We see this in politics, we see this in healthcare, we see this in different places. So what was the outcome of the needs assessment phase? The outcome was that health professionals reported lack of knowledge, that involving LGBTI organizations in targeted intervention is crucial, is very important to understand how to work together. To form a legal framework that supports human rights for LGBTI people is necessary for providing proper care. And also there is an increased need for changing attitude, stance, and increasing understanding. This was a phrase that we used to listen to many times. I've mentioned it before. Someone saying, I've never treated an LGBTI person, but I'm really open to them if they want to come. We only see as far as we know. It's very important to approach people in an inclusive way in an LGBTI friendly space, because all professionals have helped an LGBTI person. It was very interesting when we worked together with LGBTI families that were saying to the social workers who were responsible for adoptions that you have treated us, you have taken us an interview, but we didn't say anything because we were looking the way that you were looking at us. We were afraid, and many times they were right to be afraid, so that the professional would discriminate against them. And it's very important to understand that we create conditions of people who do not feel safe. And it's very important to understand that if you don't feel safe in a healthcare space, then proper healthcare is jeopardized. Booklets for do's and don'ts were thus produced to know the meaning of the acronym, the basic terminology, the gender identity, sexual orientation, sex characteristics, and gender expression. To understand the gender identity, gender expressions, and sex characteristics and sexual orientation are distinct concepts. To introduce themselves with their name and the pronouns they use when they first meet a person and ask politely their name and pronouns. It's very important to understand that from the very first question that the receptionist is making, we create, we either show people that we're an LGBTI inclusive service, or we show them that they don't have, or they should not speak about this. It's very interesting. There is also enough material about this, of how sometimes we make hypotheses for the person that comes to us. That if I see a young boy that has trouble with his or sex life, for example, I immediately start with asking the person that, what's your relationship with women? And from this expression, we understand that the boy is no longer going to open up about his sex life. If he's gay, if he's bi, if he's all different, let's say, in the spectrum of LGBTI, then we're creating barriers that this person is not going to be able to form a relationship of care. So it's very important to use open and general questions to ensure the safety, privacy, and confidentiality for LGBTQI plus people. It was very interesting when I was working with remote places that people started telling me about their gender identity, about their sexual orientation, after months of treatment, after a year perhaps of treatment, because they were very afraid that this might leak to the rest of the community. So training is very important to us. We focused in 4 different fields: primary healthcare, mental health, sexual and reproductive health, and basic terminology. These are going to be uploaded soon in Paradiso website, but also our partners, Emmanuel is here, and the team perhaps, they've already uploaded them in French as well in their own website at Maison Blanche. And I'm sure that in our work with EFPC, it can be circulated among the people who are attending webinars or working together in different ways. So what is the objective? LGBTQI individuals in Greece who face health disparities linked with social stigma, discrimination, and denial of their civil and human rights to be empowered, to create a participatory approach where it's very important to open doors in different healthcare services, in different places, in places far from Athens, far from Thessaloniki many times, and to be able to create this atmosphere. And here we can see some of the results and the suggestions that came out from the pilot intervention at EPAPSI NGO. We saw that the employees are more open in discussions on LGBTI issues, that there is a bridge between EPAPSI and LGBTI community in order to help the health professionals when supervision is needed, or help LGBTI users who need mental health care. Mental health professionals are more careful with the words they use. Monitoring mechanisms are implemented to ensure that the NGO keeps up working towards this direction. And also suggestions about volunteering from and to LGBTI community, creating a group, an activist group of mental health professionals and mental health users, as well as of people from the LGBTI community who could collaborate in the fight against discrimination, do collective actions so that LGBTI people can actually apply for a job in EPAPSI more easily, put posters and leaflets in different places in EPAPSI care centers, have a badge that shows to a person that EPAPSI is moving towards this idea. And it's very helpful to understand how we can help people get the care they have the right to do. So some myths and realities before I kind of close up this little speech. This is from a Greek myth. This is from Procrustes, as he was a famous thief. He was a famous thief. You can see this here, that what he did was actually put the people in one bed. If they were taller than the bed, he would chop off what was taller than the bed. If they were shorter than the bed, he would strain their limbs so that they could fit actually the bed. And then a Greek hero, Theseus, there is a need for heroes many times, and in Greece we have a lot of them. What he did was actually put the thief Procrustes in his own bed, and because his head was taller than the bed, he would go on to chop off his head. It's not a beautiful story, but what we want to say is that many times we're doing the same to people as professionals. This was the idea that we were trying to show the people, that when we have something in our minds and we cannot understand what the person needs, we're then doing all we can to fit them in our own ideas, to fit them in our protocols, in our categorization systems, in our diagnosis, in all these pathologizing attitudes. So let's say there are ideas of an exercise. This is material that was created by UNHCR and IOM, for example, that we also came across when we trained mental health and health professionals. They were saying gay and bisexual men have generally had many sexual partners. And this was actually something they believed in. It's like something that they said the straight person is not like this, but it's certainly a myth. Like heterosexual men, gay and bisexual men may have had no one, very few, or a number of sexual partners. Each person is different. These are just some exercises that can be used in different trainings, in different places, where we start with the ideas that actually involve healthcare. Not all men who identify as gay or bisexual have HIV. We've seen, for example, it's very interesting because in Greece, if there is a clause when you're donating blood that if you had at least even one gay relationship from 1977, then you're not eligible to donate blood because it is wrongly related to the idea of identifying gay or bisexual men with HIV. We understand that having a diverse sexual orientation does not mean you have a higher risk of contracting HIV. Rather, risky sexual behavior leads to higher rates of HIV. So it's very important to understand how we can work towards destigmatizing LGBTI issues within healthcare. And also, another idea of an exercise, if an LGBTI person has never experienced harm because they have been able to hide their sex, sexual orientation, or gender identity, their rights have not been violated. And this is something that we had to work a lot with the professionals in our work, because being compelled to conceal being LGBTI in order to avoid harm is a fundamental right to freedom of expression and to the right to live with security of person, with full recognition before the law. It was very interesting. I was speaking with a transgender individual who was saying to me that I don't want to go to hospitals. I avoid hospitals. I avoid them because they will start asking me, why, how come do I not look like the person in this photograph? They will put me in the wrong ward. They will treat me in a bad way, and I will feel stigmatized. And this is why a person avoided prevention measures, avoided being hospitalized, or they were hospitalized only during crisis. And we can understand how difficult and how serious implications this might have to a person's life. So, ending this presentation, maybe Diana or Diedrich can say more about this from EFPC. There is a call for abstracts with a deadline for the 1st of May 2019, which will actually take place in Paris. So here you can have and meet perhaps both the partners from Maison Blanche and from EFPC while you're there. And about primary care and local communities, health equity for everyone, everywhere. I think this is very important to our idea. We have to be able to not only have good laws or improve the legal system, but actually see what really happens in the reality of a hospital, in the reality of a healthcare unit, of a mental health care unit, in the reality of the training and of other different things. So this is perhaps where I want to thank you for your attention and give the speech to my colleague George, who was very effective as a coordinator from the public health school, and I really want to thank him and all the members of the consortium, because it really has been a teamwork.
Thank you, Michalis. I think that has been great presentation, and I think you have given a lot of real life examples and struggles and some myths and realities. Before moving to George or giving the word to George, we have already some comments and some questions.
Yeah. Mm-hmm.
So if Frederic can provide me the screen, I will put the screen to everyone so everyone can see everything. Okay, I'm gonna try to share it now, and please let me know when you see the screen.
Oh yes, I think we can all see the screen.
Yeah, there it is. So you're able to.
I can address the questions. It's okay.
Yeah, perfect.
Okay. So, are you connected? The first question is: are you connected to the EU thematic network? Nobody left outside, improving access to healthcare for vulnerable and marginalized groups. We're not connected as NGO specifically, but I think that it is very interesting to reach out to this network and to be able to further promote multiplying of the effects and the outcomes of the project. So thank you for this. I think this is a very interesting suggestion to be able to link up with different networks. We've already linked up with, for example, in Enter Mental Health Network, that also Emmanuel is here from the Maison Blanche, where we will also be able to present this in the conference, which will take place in June in Norway. And we've also connected with other networks that each partner has. I think that we were much focused in doing a good work in the trainings nationwide, and just because we have and we will have we will be able to reach out to more networks in the future, because as we see it, Paradiso is not just a project that finishes, but it's a stepping stone for more connections. So do you agree that the second question, that the LGBTI struggle to get full recognition for their health needs is also related to the medicalization of healthcare provision? Would a paradigm shift toward goal-oriented care could help your struggle as well? Medicalization of healthcare provision. From what I've from what I'm understanding, because my approach is from the biopsychosocial, let's say, model of care and the community mental health care in Greece. From what I've understood, we really need a paradigm shift, and this is something that we've been advocating towards during all these years. And I think that this has to do with moving towards goal-oriented care and user-oriented care, and also towards what I mentioned during the presentation, to recovery orientation. It's very interesting, because I was talking with Marit, she's a Norwegian colleague that I mentioned before, and she was saying that when I see lists and forms that say to what percentage have you achieved this or that or the other, I understand that is the professionals behind this. It's very important to be able to understand what the patient, what the person needs, and not what the professional needs. Many times I understand that we're moving towards medicalization, and we see it in our work with different vulnerable groups, like for refugees as well, where they are seen as traumatized from the very beginning. This does not leave space to really listen to the person that we have and to set up what we call an individualized care plan, which is, I understand, similar to the goal-oriented care. And if so, there is still a lot to gain in all parts of Europe, and it will be enabled to join forces with other groups in Europe struggling with similar projects. Thank you. I think this is our idea as well. And also, thank you, Manuel, for the comment. I don't know if there are more questions or someone wants to say more about the...
Yeah, I'm trying to see. I don't think there are more questions, but I'm not sure. Maybe I will give the floor to George because maybe he wants to share some thoughts too.
Of course.
Okay. Thank you very much. Thank you, Michalis, for giving this lecture. I have just one comment on the second question. I suspect that, for my understanding, is that we're talking about a shift towards from the hospital-oriented healthcare provision to a more primary healthcare oriented. It seems that the LGBTQI people do not face different problems, health problems from the general population, although or there are specific problems related with their sexual orientation or their identity. So I think that the issue here is that, for my understanding, is that it's an issue for human rights in the first place, and equal access to specific to individual care. So I'm not. This is the way that I understand this this comment. And if we suppose that medicine or give some labels or some identities to or connects medical problems with sexual orientation, yeah, that's the in this case, this is the problem.
Okay, thank you. I'm not sure if anyone from the attendees would like to step in, because I have seen you have some of your colleagues connected, so maybe they want to say a few words, and if not, I will just, well, thank you, you both, in case, I don't know if you have final words or you have already said your final words, and especially if you have a contact, if someone wants to contact you, how do they do it?
The project is typically ends at the end of April, but the network or the people who have worked together in the context of this project, where the contact will be open, the network will be open. So if someone gets through our regular email or the PARADISO site, this will be a good starting point for future collaborations or further questions. We have to upload the booklets on the site and some the educational material in some form. So the project, although typically will finish, the network will try to keep it open as long as possible.
Okay. Well, so in that case, I just want to thank you both, because I think it has been a great presentation. And thank you for presenting the PARADISO project. I think for the people that has been attending. It has been quite interesting, and you already said how they can contact you back. So I just want to take the opportunity also to present you the event that we will have, and already Mihaly said some words, but it's going to be in Nanterre, in one of the suburbs in Paris, on the 30th of September and 1st of October. And if you want to send an abstract, you can do it in these days, because the call for abstract is open until the 1st of May. And we will be very happy to have you there, because this topic, it really fits on our main topic this year, which is about primary care and local communities and health equity for everyone everywhere. And we will be happy to have you there. And on the other side, just congratulate you, because it's been 1 year, and I think it has been quite an intense year, but you have achieved quite a lot of things. And I think it's not the end, it's just the beginning, but I think you are on the way. So thank you so much for presenting us the project today. And thank you for all the attendees for coming to the webinar series.
Thank you, Diane and colleagues, for the floor that you gave us.
Thank you. Thank you.
Bye.
Thank you. Bye.
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 Bye-bye.